Good evening, folks. I have discussion E for you, last one of the evening. And the title is Government Needs to Show Plan for Mental Health Community Care, says Labor MP. Okay, here we go. We're going to dive into that tonight for E. Please join me in tonight's discussion E. Government needs to show plan for mental health community care. Okay. The headline, Government Needs to Show Plan for Mental Health Community Care, says Labor MP, captures a growing concern that legal reforms alone, such as those proposed in the government's mental health bill, are not enough without a tangible operational strategy to support people in the community. Labor MP Jen Craft is calling for more than verbal commitments. She wants a detailed, costed, and time-bound plan that assures people with learning disabilities and autism are not left languishing in hospital settings due to a lack of appropriate community-based initiatives. Why this demand is urgent. Craft's intervention is rooted in a stark reality. Over 2,000 people with learning disabilities or autism remain in mental health hospitals, often for years, not because they need to be there clinically, but because there is now nowhere else for them to go. The average stay for these individuals is nearly 5 years. This is not just a policy failure, it's a human rights issue. The promise to not only enact parts of the mental health bill when community service are ready rings hollow without a clear roadmap for how those services will be developed, staffed, and funded. The structural gap exposed. The article underscores several critical gaps. Policy without infrastructure. Legal challenges that aim to reduce unnecessary hospitalization are undermined by the absence of community infrastructure. Without supported housing, trained staff, and wraparound care, people cannot be safely discharged. Okay, workforce shortages. Community mental health teams are already overstretched, scaling up Scaling up services to accommodate discharges from inpatient settings requires a significant investment in recruitment, training, and retention of staff across health and social care. Lack of accountability. There is no published timeline, no budget, no allocation, and no mechanism to track progress. This leaves families and advocates fearing that people will remain in institutional limbo, even if the law changes. The broader implications. Kraft's call reflects a wider frustration among campaigners and charities who have long warned that the Transforming Care agenda, launched over a decade ago to move people out of long stay hospitals, has stalled. The risk now is that the mental health bill could become another symbolic gesture unless it is backed by credible implementation plan. In essence, the MP is demanding that the government stop treating community care as afterthoughts. Instead, it must be the foundation upon which any mental health reform is built. Without it, the promise of person-centered rights-based care remains out of reach for thousands. Okay, guys. So that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. See everybody tomorrow for shows. Have a good evening, folks.